Okay, let's make today easier. We have only one topic to cover today. We have a table here, an extra table. Do you know what it is for? Yeah. This weekend there will be important exams here in Zhengzhou University. That exam is the exam to enter graduate school. So after graduation from college, when you go to graduate school, you need to attend the exam. And it's very competitive, very competitive. It's similar, it's a national exam. Yeah, everyone needs to attend the exam. And there are several exams including politics, English, and also some professional subjects like medicine, like that, according to what major you want to study. And if you guys want to go to graduate school here in China, I think it's easier, right? You don't have to take the exam. You just submit the application, right? Especially for pharmacists. Yeah, not every university accepts international students. Only top ones. Yeah. And I would mention that you guys are starting in Zhengzhou University. Did you have any idea before you come to China about Zhengzhou University? Yes? I can tell you, okay, the truth is Zhengzhou University definitely is not one of the top universities, like 985 Project University. It's not one of the top universities, but I can tell you that Zhengzhou University is of the first level universities. It's not one of the best one, but it is definitely one of the first level one. In Henan province, the data here, in Henan province, only the first 1% student in high school can come here. The first 1%. It's very competitive. So you want to make your day valuable when you study here. Yeah, it's okay. A lot of students here in Henan province, even they study hard, they cannot come here to study. Yeah, that's true. All right. A little bit of thing about the final exam. You guys had so many questions about the exam. Okay, listen to my word. If you finished all the quiz questions, the homework questions, you will feel familiar with every question for your final exam. Do you understand that? Okay? So if you take the quiz seriously, you finished all the questions by yourself, you are ready for the final exam. All right? So there's no reason to worry about my microbiology part. Taoxing, quiz. It's a lot. I understand it's a lot. I give you so many quizzes to urge you to study all through the semester, at least all through the 8 weeks. After you finish the questions, you are almost ready for the final exam. So don't worry about microbiology. And I picked the questions from the quiz, your homework, and I also made it easier by reducing one option. So in the final exam, you only have 4 options for the multiple choice questions, A, B, C, D, okay? It's much easier. And when you do the homework, the quizzes, if you feel that some question we didn't cover in the classroom, you won't see the same question on your final exam. That's okay? Okay. That's only usable for you guys who listen to my lecture. Okay. All right. Today, we'll talk about enteroviruses. Then the rest of the time, we'll introduce a little bit about prions. In previous years, we didn't introduce prion. Ready? Okay. Enteroviruses. According to the name, what information can you get? What's the meaning of entero, the first part? It's our digestive tract, right? So that's the major part of infection or entry into our body, the enteroviruses. There's a lot of different type of enteroviruses, but we'll focus on polio today. Okay. Enteroviruses belong to a big group, big family called picoRNA virus. In this name, picoRNA viruses. Here, RNA means that their genomes, the genetic material is only RNA. It's single-stranded positive sense RNA molecule. Anyone know the meaning of pico? Pico? I heard the correct answer just now. What's the meaning of pico? Yeah, correct. So pico means small, right? So picoRNA viruses, the viruses are relatively smaller than others. So in this big group, there's important genera we'll introduce. Today we'll learn about enterovirus, which belong to the picoRNA virus. And we'll focus on polio, a little bit on Coxsackie A and B. And there is another genus called rhinovirus. You know the meaning of rhinovirus? What's the meaning of rhino? Yeah, nose. So this is a virus which get into our body through our nose, causing the upper respiratory tract infection. So they cause common cold. Common cold is not a single disease. It's not a disease caused by a single pathogen. We can say that common cold is just a summary of symptoms of similar disease. Right now, we know that even though all of the common cold are due to viral infection, so definitely all of them are due to viral infection, but there are more than 200 different viruses which can cause common cold. And of those 200 viruses, rhinovirus is just part of it. And there are also other viruses, such as we know that there are 4 types of coronavirus which cause common cold. Coronavirus causes common cold, which causes about 15% of all the common cold cases. And there are also others. Okay, so that's the picoRNA viruses. We'll focus on enterovirus. Here are the categories of enteroviruses we'll talk about today. We'll focus on polio, and we'll talk a little bit about Coxsackie A and B, and also echoviruses. And also there are other enteroviruses, like enteroviruses type 71, this one, is the major pathogen of foot-mouth hand disease. Yeah, hand, foot, mouth disease. We'll talk about that later. And enterovirus type 71 is one of the major pathogens. And the good thing is that here in China, we have a vaccine available to protect type 71, only 71. Okay. Okay, let's introduce a little bit about the common features of enteroviruses, common properties. First, their size. And enteroviruses are only 28 to 30 nanometer. That's the diameter. Okay. So this size is relatively smaller than other viruses. Just remember the size of influenza virus. We talked about that yesterday. Anyone remember that? You should have it in your notebook. It's 100 nanometer, around 100 nanometer. So this is relatively much smaller than that. And the genome of enteroviruses here is RNA, single-stranded RNA, and positive sense, and linear RNA. There is a typo here. It's not linear, it's linear. And it's not segmented, just one single RNA segment. And there is no envelope, so enteroviruses are naked virus. And because this is a RNA virus, they replicate only in the host cytoplasm. They don't get into the host nucleus. Okay, later I'll show you the life cycle of polio. Transmission of enteroviruses is mainly due to the fecal-oral route, like ingestion via contaminated food or water. So that's the major way of poliovirus infection. But it's also possible that poliovirus can transmit through direct contact with infected hands. If your hand is contaminated by material containing poliovirus, when you touch your nose, it's possible that you'll get infected. Or it's also possible due to the inhalation of the infectious aerosol. If someone in this classroom is infected by enterovirus, the person might release the virus in aerosol, in droplets, and other people might get infected or induced. So this is the major transmission pathway. Okay, and let's have a look at the pathogenesis of enteroviruses. The viruses can get into our body in two different ways. Either ingestion, get into the digestive tract, or that it enter the respiration way, the tract, through aerosol. Okay, so that they can replicate in our throat, the upper part of the respiration tract. Or if they are ingested, they can get into the intestine and replicate in the Peyer's patches. So after entry and primary replication, large number of enteroviruses will be released. And those viruses then would get into the circulation system, the bloodstream, forming the primary viremia. So that's the viral particles get into the bloodstream. And once they get into the bloodstream, they can be distributed all over our body, okay, to every tissue. And they will then infect the target tissue to cause a secondary viremia. And different types of enteroviruses have their own specific target tissue. Like hepatitis A, we'll introduce next week, is also one of the enterovirus. It targets the liver to cause liver inflammation. While for polio and echo and some pox virus, it targets the central nervous system, causing meningitis and encephalitis. What's the meaning of encephalitis? Anyone know? It's the problem in the brain inflammation like that. Yeah. And okay, so different type of enterovirus has their own specific tissue for their further replication. And today we will introduce polio in detail. Polio, Cox A, Cox B, and echo. So that's the enteroviruses we want to know about, and we'll introduce polio in detail. Polio can, well, once they get in, cause infection. Previously, I had some understanding that after polio infection, it causes serious problem in everyone who got infected, but that's not true. Only a very small number of persons infected by polio would get disease. Majority of them would asymptomatic, so that means no symptoms. 90% of the people infected by polio doesn't cause any disease. And it can cause meningitis, and very small number of it would cause paralysis. Later I'll show you the data. Okay, so we'll talk about polio in detail. Okay, immunity against enterovirus. Antibody is a major protective immune response to enteroviruses. Why? Why after enterovirus infection, antibody is important? As we mentioned in the pathogenesis, that after enterovirus infection, it can cause 2 waves of viremia. So there is a direct contact of virus with the immune system. So the immune system can be stimulated to produce antibodies. And there are 2 types of antibodies, like the secretory antibody, IgA, can prevent the initial establishment of infection in the mucous membrane. And in our blood, the serum antibody, okay, including IgG, IgA, IgM, prevents viremia spread to the target tissue and therefore causing disease. So antibodies plays an important role. While cell-mediated immunity, like CD8 positive T cells, is not usually involved in protection, but may play a role in pathogenesis. So after virus infection, the T cells, okay, cells also can get activated, but they cannot remove the virus or eradicate the virus, but they can cause cellular damage to kill the infected cells, which can plays a role in pathogenesis. So that's the immunity. Okay, so that's our VIP, the major player, poliovirus. I assume that you guys have been heard of poliovirus for a long time. At least you didn't see anyone at your age who got infected by poliovirus, right? No. But the older generation, do you know someone in your life, or your neighbor or family or relatives who are polio victims? No? You're not infected, right? You know someone. Relative? How old is the relative?
He cannot walk and all his body, like he's now 25 years or something. He cannot move. Someone needs to take
Is now 25 years old?
Yes.
Wow, that's so unlucky because in recent years we don't have polio infection anymore. Especially in China, we eradicated the wild virus infection in 1990s, but before that, there were a lot of cases in China. And after that, after 1990s, there is no wild virus infection anymore. Let me show you some polio victims. So polio targets on the little kids who are under 5 years old. Those little kids. This is an old picture, maybe decades. They took it decades ago. And the major problem it can cause is the paralysis. That's a paralytic polio. And usually it targets on the little kids, the children. But like decades ago, it also causes the adults who are not immunized with polio infection. Does anyone know this guy? No? If you learn history, probably you saw his picture before. This is this is the President Roosevelt. It's the president during World War II of America. You can see that he's sitting in a chair wheel. He actually was a victim of polio infection. He got infected when he was around 30 or 40 years old. And after he got polio infection, he was elected as the president of America. But he tried his best to hide the information. So at that time, a lot of American people didn't know the information. And after that, they finally got a notice that their president cannot stand up. Okay? Okay. Polio. This is the virus. And this is the electron microscope picture. And you can see the particles of polio virus is also spherical. So the spheres. This is not a real picture. This is based on the information they made this art picture of polio virus, and the different color on the surface are different protein molecules. So you can see that there are 4 different proteins on the surface. Okay, polio structure, and RNA core covered with the protein capsid, the naked virus. Okay. The source of polio infection can be either the apparent or inapparent patients. Those people who had polio infection showing symptoms, definitely can release the virus, or those healthy carrier. We mentioned that 90% of them don't show any symptom. They can also release the viral particle. So that's a source of infection. The main portal of entry is mouth. So directly or indirectly, they get into the body. Or it's also possible that through inhalation of aerosol. Poliovirus is regularly present in the patient's throat or in the stools before the onset of symptoms. So based on this information, we know that without vaccines, it's really hard to prevent polio transmission because you don't know someone's next to you who looks healthy, but the person is releasing poliovirus. And poliovirus, once get into the person's body, if they get into the peripheral nerves, they can travel to the central nervous system in axon. And we know the structure of neurons. The axons can be very long, can be over a meter long. So the virus in the neuron can take the axon as a highway, travel to the central nervous system with a high speed. And finally, they can influence the spinal cord or the brain. So that's how the polio virus spread in the nervous system. Okay, this is a life cycle of polio virus, a replication cycle. So it's actually consistent with the general knowledge we talked about before. Poliovirus is positive sense RNA virus. Positive sense RNA virus, it replicates only in the cytoplasm, so it does not get into the nucleus. So that's the major point. So this after infection, the viral genome is positive sense. It can be used as messenger RNA directly to translate proteins. So there is a big protein peptide translated, then protease would cut it open to form functional proteins. So that's translation to make the capsid material. While it can also replicate its genome. And to replicate the genome, it uses the negative sense strand as a template. So from the positive sense, it makes a lot of copy of negative sense strand, which can be used as template. Then with this one, it makes a lot of positive sense strand as a genome for new virion particles. So this is what we mentioned before. But there is something we didn't mention for this specific virus, that here, for the genome replication, it's associated with membrane, a membrane vesicle. This membrane vesicle is actually stolen from the ER, the smooth ER. So the virus somehow got the membrane structure from ER. So for any specific virus pathogen, their life cycle is kind of specific for their own. We just introduced the general knowledge before. The life cycle of polio. After exposure, after infection, the incubation time of poliovirus is 7 to 14 days. So it varies. And here's the data we mentioned just now. The inapparent infection is over 90%. So 9 out of 10 persons infected by polio didn't show any symptoms. Okay? And of the other 10%, only some of them would develop mild disease, such as fever, malaise, and headache, which is similar to like common cold symptoms. And very small portion of the people with mild disease would develop non-paralytic poliomyelitis. It causes poliomyelitis but it does not cause paralysis. So this we call aseptic meningitis. This meningitis in the brain, but it is aseptic. What's the meaning of aseptic? We learned that before. Here, aseptic means no bacterial infection. It's just a virus infection. It's just virus infection, no bacterial infection. So we call it aseptic meningitis. And only less than 1% of all the people infected by polio would develop paralytic poliomyelitis. And the major disease, major symptoms is the flaccid paralysis, influencing different type of muscle. It depends on in different person. Some person might influence the muscle on legs, while others with serious problem, the polio infection influence the muscle related to respiration. That's more dangerous. So this is the equipment which was invented in 1930s to help those people infected by poliovirus, and also there is paralysis in the muscle related to respiration. If the muscle group involved in respiration cannot contract, you cannot breathe, right? Your ventilation is not effective anymore, so you cannot get in enough oxygen. And those people would die immediately if the ventilation is not helped. So they invented this machine called iron lung. It's basically it's made of iron lung, to help the person to breathe. So basically this is a chamber. Let me show you. This is a chamber. Uh, and you let the patient to lay in the chamber, but with the neck surrounded by a rubber and with the head outside of the chamber. Then you turn on the machine. The machine would change the pressure inside the chamber up, high and low, high and low. So that pressure would help the patient to inhale and exhale, so that you help the patient's ventilation. And this, excuse me, it's kind of like that. It's like the artificial ventilation machine, but this one, it does not cause any invasion into the patient's body. You don't use the tubes, so that the patient might live a better life with the help of this machine, the iron lung. Iron lung was actually popular in America for some time. During the polio outbreaks in 1940s, this is a real picture of the hospital ward. You can see so many patients in iron lung, and the iron lung can help them to breathe. And actually, a lot of people relies on the iron lung all their life long. And some people survived to their 80s or 90s. So several years ago, there was a discussion that those patients living in the iron lung, they need help because the machine is getting old and they cannot buy the parts if the machine is out of order, because the factory is already gone. The factory making the iron lung is already gone, so they cannot buy the parts. That's a topic people talked about several years ago. But in a couple of years, I heard the news that the last patient living in the iron lung has passed away. So this machine is a historical product, and we can only see it in museums in future. It's not being used anymore. Okay, the iron lung. Let me show you how it works. Then after that, we'll have a break, okay?
Hi, I'm Cassie Nesper from the Rose Malnick Medical Museum at Youngstown State University. Today we're taking an in-depth look at the iron lung. Let me get out of here so I can show you around. Iron lungs usually refer to respirators that encase your entire body. They can be used in any kind of illness that impairs your breathing, such as paralysis of the diaphragm or severe cases of polio. They work by varying the air pressure inside the chamber. When the pressure becomes less than that inside your lungs, you inhale and air expands to fill your lungs. When the pressure is more than that inside your lungs, you exhale. Devices similar to the iron lung have been around since the 1830s. Philip Drinker and Dr. Lewis Shaw were the first to use the term iron lung to describe their machine in 1928. It was used widely in the polio epidemic that year. John Emerson, who ran a medical machine shop nearby, also saw their model. He made some improvements, including ports on the side where nurses could access the patient for care, and a bed that slid in and out. His first machine is now part of the Smithsonian Institution at the National Museum of American History. During the polio epidemics of the 1940s and 50s, American hospitals had wards full of polio patients and iron lungs. So let's turn this thing on. The switch for the motor is on the front, along with a switch for the light inside the chamber. At the bottom is a knob that controls the respiration rate of the machine. It can go between 12 and 20 breaths per minute. Along the top is a gauge that measures the pressure inside the chamber. Next to it would have been an alarm where a light would go off if the pressure inside the chamber goes below a certain level. In case of electrical failure, there's a handle at the rear of the machine for manual operation. Along the side are ports for nurses to access the patient and windows. At the head of the machine is the collar that fits snugly around the patient's neck. This would have been made out of a sponge material or a plastic. There are also knobs to adjust the bed position inside, and a mirror so the patient can see what's going on in the world around them. This could also be a book rest, although somebody else would have to turn the pages. If a patient were in the iron lung for polio, they would be in there for about 2 to 3 weeks until they got well enough to breathe again on their own. So there you have it, the iron lung. Join us next time for a tour of the wooden X-ray machine.
Is the head up for sure?
Yeah.
I was working a new job, had quit college to get married, and got sick my third day at work. And felt like I had the worst case of flu in the world, a bursting head and the whole thing. Everything was extremely sensitive. And I became weaker the next day. Couldn't walk then. The third day I couldn't breathe right, so rushed to the hospital. Doctors thought it was encephalitis at first, because this was 1956, and polio was on its way out. Most of the bad cases had been in the early 50s. But they realized they pulled an old iron lung out of the basement. This was St. Luke's Hospital. And so I was in that for 3 months. probably 20 years after I had it was when I started having the breathing problems. So I went back to the hospital, and at that time they decided I needed the lung to sleep with. Okay, let up. Now they're believing it was post-polio. You don't get the disease again, but the little nerves that you were operating on get weaker. This is a real character blow for me because I was always very independent. And learning to depend is hard. Most of the work of your breathing is done by your diaphragm, and so it gets very tired after all day if you're working with fewer muscles. And the lung just takes over the breathing for me when I'm in it. It's a relief to get in, it's a relief to get out. It's like, you know, you're ready for it at night, tired. Just go right to sleep. Then in the morning, you're ready to be out. The fact that it's available and the statistics are so good for the prevention, it's just a wise thing to do, I believe. People are afraid they hear stories of cases where people got polio anyway or some other dreadful thing, but it's so rare that it's worth taking that little bitty risk, is to let it go rampant again and be epidemic, which could happen.
All right, it's almost time. How about we have a break? Okay. Immunity after polio infection. Once a person is infected by poliovirus, the person would set up a long-term immune memory, like secretory IgA and neutralizing antibody, IgG, IgA, IgM, can persist in the person's body for lifelong. So as mentioned in the video we played just now, that a person won't get polio infection again, but there might be some post-infection problem. So as in the video, the lady had the post-infection problem. But immunity, it can set up firm and lifelong immunity. For polio prevention, I assume that you guys every one of you received polio vaccines when you were little. Do you know that? Or do you have a record about that? Your vaccine record, does that contain polio vaccine? You didn't know it? Yeah. Before you come to China, do they require you to provide the vaccination record? No? No? Okay. But polio vaccine is regularly administered in almost every country. Right now, there are two types of polio vaccines. One is polio vaccine? You did? Yeah. Okay, polio vaccine, I don't know what type of vaccine you received. Right now, there are two types of vaccines. One is OPV, short for oral polio vaccine. This OPV is actually attenuated live vaccine. So we just mimic the oral ingestion of the virus. It's attenuated virus. Usually, like in China, we make the vaccine in a candy, or for the little kids, they make it in the serum, like syrups, to drop in the mouth. So this is OPV. It contains real attenuated virus. A second type of virus is called IPV. That's the inactivated polio vaccine. Because it's inactivated, it's safer, the IPV. Both of them actually have their own advantages and disadvantages. Like for OPV, the good thing of OPV is that it mimics the natural infection, so it can induce production of secretory antibody, which is similar to that of natural infection. And it can set up long-term infection in the person's body. And also, once some kid receive the vaccine virus can proliferate in the kid's body, even though usually it does not cause disease. The kid would also release the virus to the surrounding environment and transfer the virus to other people, so that OPV is able to help to set up herd immunity. We learned that before, right? Herd immunity in the population. And it's easy to administer the polio vaccine. You just drop in several drops in the kid's mouth or give the kids a candy. That's it. But the disadvantage of OPV is that there is a risk of vaccine-associated paralytic poliomyelitis. You know, because it's still virus, the virus can mutate and regain the virulence, so that once the kid received OPV, and there is a very low chance that the kid might suffer from disease. And this ratio is around 1 out of 1 million who received the vaccine. So that's a major problem of the OPV. And the virus can also spread to contacts if it mutated and become virulent. It's a problem. And also, it's not safe for the immunodeficient patient. For example, if the patient is born with immune compromised system, and they cannot fight against this vaccine, so they would get disease. So that's the disadvantages of OPV. While for IPV, similarly, it has its own advantages. First, because it's already inactivated, it's just the components of the virus, including the protein molecules. So the stability is good. You don't even rely on the cold chain to transport the vaccine, okay, and storage. So it's relatively stable. And it's safe to administer the IPV to immunodeficient patients because they don't cause disease. It's just the protein component. And there's no risk of vaccine-related disease. So that's a good thing of IPV. But the disadvantage of IPV is that you just inject the material, so it cannot induce the local immunity, such as the secretory antibody. And also, that injection is always painful, especially for the little kids. They would cry a lot. It's painful. And in different countries, they use different strategy for polio vaccination. Like in Western countries, in America, IPV is being used. Previously in China, we used OPV. When I was little, I guess I received OPV. But due to the disadvantages of both vaccines, nowadays in China, we apply a strategy combining OPV and IPV. So for the little kids, for the primary immunization, we use IPV to stimulate the immune system. After that, we use OPV for boosting, so that we can use the advantage of both of them, and it's safe. And we adapt this strategy since 2019, not a long time ago, 6 years ago. Okay, so that's the vaccine against polio infection. Okay, the rest of the time I will talk a little bit about the global polio problem. Probably we mentioned this a little bit before. Polio, as we mentioned just now, mainly affects children under 5 years of age, the little kids. They are the major targets. And even though only 1 out of 20 even only 1 out of 200 infections leads to the irreversible paralysis, the disease, serious disease. And among those paralyzed, those people, 5 to 10% would die because their breathing muscle become immobilized. So that's a serious cases. And cases due to wild poliovirus have decreased by over 90% since 1988. So that's way before you were born. From at that time, there was about 350,000 cases in more than 125 endemic countries. But now, the data since 2023, there are only 2 endemic countries in the world. Okay, the 2 countries are Pakistan and Afghanistan. Let me show you a map later. Okay, since there are still wild virus in the world, we haven't finally eradicated all the viruses, so that every child in the world, they need to receive polio vaccine. Because once you stop using the vaccine, the virus would spread from those hot points to other countries. So that is why we need to use the vaccine. And not only the vaccine, and sometimes we need to use a lot of boosting vaccination so that we can finally prevent the spreading of polio. Okay, so there are some reasons. Yeah, here, this is a map of polio infection. So those are the hot points of polio infection by wild virus. The major reason of this problem is that in those 2 countries, in villages and tribes, there are some they don't believe in the Western country. There is rumor about polio vaccine that the vaccine might cause infertility in those countries. The WHO tries its best to provide free vaccine to those people, but they don't believe in the Western country. So WHO right now is trying to produce the vaccine here, Indonesia, which is also an Islamic country, and then transport the vaccine to those countries. hopefully within a short time, we can finally eradicate poliovirus like we did for the smallpox virus. And after that, we can stop using vaccine all over the world. Okay, you guys will be a doctor in future. Most of you guys, or some of you guys, do you know the meaning of doctor? The word of doctor? And right now, we call the people working in the hospital doctor. Previously, what's the original meaning of doctor? That's right. Knowledgeable. So someone with a lot of knowledge, we call them doctor. So it was used in universities first. We call the professors with a lot of knowledge doctor, and then later it was adapted in clinical practice that we call those people doctor. And that means that to be a real doctor, you need to know a lot of things, right? So don't complain about too much material to learn. And when you master a lot of knowledge, when you know a lot of things, you want to try to use it. When you are a real doctor, you want to try to teach your patient, okay? Educate your patient and tell them that it's important to receive the vaccines and to set up herd immunity to help themselves and also help the whole population, help everyone in the world. Because infectious disease and vaccine is not a personal problem, and it's a problem of the whole population, whole Homo sapien. And like what happened in recent years here in America, in North America, there was a problem of measles outbreak. You know measles? It's also a virus disease. And it has been for a long time, for decades, there's no measles cases in America because of utilization of vaccination. But in recent years in America, a lot of people just stopping using vaccine. They thought they are smarter than the experts, and they believe in the rumor that measles vaccine MMR would cause autism. And that's just a rumor. It's not true. And they stopped using the vaccine for some time. And since last year, there was an outbreak in America of measles. Till now, over 1,000 people got infected, and several of them couldn't survive. They finally died. And measles is very infectious. If it requires almost everyone to get immunized to stop the spreading of measles. Okay, so just keep that in mind when you work as a doctor in future. Try your best, use your knowledge, and help your patient, educate your patient to protect them and also everyone else. So this is the polio problem. Okay, we'll talk a little bit about Coxsackie virus and echovirus. There is just one type of disease called hand, foot, and mouth disease. Have you heard of this disease? Or any one of you experienced this disease when you were little? It's also common in little kids. It's a virus infection mostly due to the Coxsackie type A. And symptoms include like fever, malaise, and sore throat. And you would find the vesicles on the kid's tongue and their hand, the vesicle here, hands, and also the feet. So that's why we call the name hand, foot, and mouth disease. And this is the Coxsackie virus is highly infectious. And there is no specific medicine available to inhibit Coxsackie virus right now. And you can only support the patient with support their symptoms recovery. And because it's very infectious, the patients usually are isolated. You want to isolate them at home or in the hospital to avoid contacting other kids so that we can stop this Coxsackie A virus spreading. The good news is that most of the kids with this disease can recover by themselves. So it's not a dangerous infection. Okay, so that's the last type of disease we want to talk today. Here are some videos. Do you want to watch some of them? This one.
In poliomyelitis, also called polio, polio refers to the poliovirus, which is an enterovirus that invades the intestines. And myel refers to the spinal cord, which is affected in the disease. And itis refers to inflammation. So poliomyelitis is an enteroviral disease that first enters the body through the intestines, but then spreads and causes nerve injury in the spinal cord. Former US President Franklin D. Roosevelt contracted polio when he was a baby, and it left him wheelchair-bound. Broadly speaking, the nervous system consists of two parts. The central nervous system consists of the brain and the spinal cord. So the peripheral nervous system includes the nerves that fan out from the central nervous system to reach the skin, muscles, and organs. Now, looking at a cross-section of the brain, there's gray matter at the periphery of the brain. This is called the cerebral cortex, and it consists of nerve cell bodies. Just inside the gray matter of the brain is the white matter, and it consists of nerve axons. In contrast, if you look at the cross-section of the spinal cord, the white matter is on the outside and the gray matter is on the inside. And overall, it kind of looks like a butterfly. If we draw a horizontal line through the spinal cord, the front half is the anterior or ventral half, and the back half is the posterior or dorsal half. And the butterfly wings are sometimes referred to as horns. So we have two dorsal horns that contain cell bodies for sensory neurons, and two ventral horns that contain cell bodies for motor neurons. So for example, if you step on a Lego in your living room, the sensation of discomfort is carried from the nerves in your foot through the peripheral nervous system to reach the dorsal horn in the spinal cord. It then travels up the spinal cord to the brain. In response, your brain sends a message through the upper motor neurons, which are part of the cerebral cortex, and down the spinal cord to a lower motor neuron, which is located in the anterior horn of the spinal cord. From there, the signal finally gets delivered to the leg muscles and allows you to lift your foot. In addition to sending signals from the brain, these lower motor neurons also release trophic or growth factors that promote muscle growth in the muscles that they innervate. Polio is a viral infection caused by poliovirus, which is a single-stranded RNA virus that's protected by a capsid, which is a protein coat. Polio mainly affects children under the age of 5, and it's spread by fecal-oral transmission, which means that the virus usually enters the body through contaminated food and water that goes in the mouth. It's also transmitted when an infected person sneezes or coughs, which spreads thousands of virus-containing droplets into the local area. Once the virus enters the body, it binds the mucosal cells of the oropharynx and small intestine, and gets inside those cells, and then releases its RNA. The viral RNA uses the cell's RNA polymerase enzyme to make copies of itself, and then the new RNA copies hijack the ribosomes that normally make proteins for the cell, and forces those ribosomes to make viral proteins instead. The viral protein and RNA self-assemble into lots of new polioviruses, and within days they cause the mucosal cell to lyse, releasing the newly formed viruses, which make their way to nearby lymph nodes and eventually into the bloodstream. Poliovirus prefers to infect motor nerves, so oftentimes it'll leave a blood vessel and get into the interstitial tissue of muscle. From there, poliovirus invades the motor neuron and travels retrograde, meaning backwards up through the axon, to the anterior horn of the spinal cord. Infected motor neurons attract immune cells like neutrophils and macrophages, which cause inflammation and damage to the spinal cord. As infected motor neurons die, the muscles of the trunk and limbs no longer receive signals from the brain, or trophic factors, which causes the muscles to start to atrophy and become weak. On rare occasions, poliovirus can cause bulbar polio, which is when it affects a part of the brainstem that has motor nerves involved in speaking and swallowing. This part of the brainstem also sends motor nerves to the diaphragm, and so if they get damaged, it can impair breathing. Some people also develop post-polio syndrome many decades after the initial infection. To understand this, it's important to know that when polio damages some motor neurons, other nearby healthy motor neurons form collateral branches to innervate the muscles that have lost their innervation. Now, over time, the natural process of aging causes motor neurons to die. So when a motor neuron dies from the aging process, a person doesn't just lose function in the muscle cells that they were normally innervated by, but also in the other muscle cells that were innervated by collateral branches of that motor neuron. Most individuals infected by poliovirus have no symptoms. In fact, polio only causes paralytic disease about 1% of the time. Symptoms of paralytic disease from polio include high fevers, intense muscle pain from spasms and weakness, loss of muscle reflexes, and eventually paralysis. Usually the paralysis develops over a few days and is asymmetric, most often affecting larger proximal muscles, especially in the legs, like the thighs. Infants with poliomyelitis often develop acute flaccid paralysis, where they go limp, kind of like a rag doll, which is why it's sometimes called floppy baby syndrome. Ultimately, if the motor nerves to the diaphragm are affected, it can cause difficulty breathing and even death. Diagnosis of polio is based on the recovery of poliovirus from a stool sample or a throat swab. Poliomyelitis can also be diagnosed by a lumbar puncture where cerebrospinal fluid is removed from the lumbar sac with a needle. The cerebrospinal fluid might have an increased number of white blood cells or poliovirus RNA. There's no specific treatment for polio, but the key is to support individuals as they deal with the acute infection. Typically, that means pain medication to help with muscle spasms and decompression of the bladder. Finally, individuals might need respiratory support if they have trouble breathing, something that historically required a device called the iron lung. Fortunately, it's possible to prevent infection with a vaccine, and humans are the only natural host for the virus. There's inactivated poliovirus vaccine, or IPV, which is where dead or inactive virus is injected into the muscle. And then there's oral poliovirus vaccine, or OPV, which is a weakened strain of the live virus. Very rarely, about 1 time in a million doses of the vaccine, the weakened virus in OPV mutates within the intestines of the person getting vaccinated, and it reverts to a form of the poliovirus that can cause paralytic polio, called vaccine-associated paralytic polio, or VAPP for short. VAPP usually affects close contacts, like someone that lives in the same home. But sometimes the weakened virus reverts to a form that can cause vaccine-derived poliovirus, or VDPV, which not only affects close contacts, but can cause outbreaks of poliomyelitis in communities that have low rates of vaccine coverage. VAPP and VDPV are both worrisome, but the events are relatively rare and mostly affect unvaccinated individuals. So the benefits of polio vaccine outweigh the risks, and polio vaccine is recommended. In fact, because of IPV and OPV, poliovirus is nearly eliminated worldwide. It only circulates endemically in a few areas within countries like Afghanistan, Pakistan, and Nigeria, where there's poor public health and limited vaccine coverage. All right, as a quick recap, poliomyelitis, or polio, is a viral disease caused by the poliovirus. It's transmitted by fecal-oral transmission or by aerosol droplets. The virus replicates in the small intestine and oropharynx before it spreads to the central nervous system and causes nerve injury. Diagnosis is done by the recovery of the poliovirus from a stool sample or a throat swab, or by the analysis of cerebrospinal fluid. Lastly, there's no cure for polio, but it can be prevented by polio vaccines.
Hey guys, it's Sam again. I hope you enjoyed this video on poliovirus. I love neurology.
In previous years, I played the video in the classroom a lot, but this year I didn't play a lot of video for you. And you can actually find those videos on YouTube. Okay. A little bit about our teaching project, the questionnaire. And we noticed something that both the students and the teachers complain about the English quality. And some teachers say that students' English is not good, and you also mentioned some teachers' English are not good, and vice versa. And also there is a big problem mentioned that for subjects on medicine, there are a lot of terminology, a lot of jargon. It's not easy to remember. And do you have any idea how to solve that problem? Like right now, you probably have a preset course to learn English, right? The medicine English. Will that help? Do you have a previous course before you learn the subject? You learn the English, yeah? Or that should we suggest the office to ask new students to provide the English capability test, like certificate, like you should submit like a TOEFL test or other tests when you apply for university here. Is it easy for you to take the TOEFL test at home in Iran or in other countries? So you need to go to neighboring country, Turkey. Yeah, it's not easy, I understand. But you know, online test. Yeah, yeah. You know, it's important to have a relatively high English ability to study medicine within the area. The other strategy is that the university should be strict on the students. You don't allow so many students to graduate. That will help. That will push you to study. Like in America, you know, do you have any idea of the ratio of graduation in a university in America? No, not that low. 60%. Only 60% of all the enrollment can graduate in 6 years. That's for college level. So the students would have a lot of pressure, and if they don't study hard, they won't graduate. And if they like make some serious problem in college, they cannot continue to study there. So it's very strict. And should we suggest Zhengzhou University to apply the same strategy? It's easier for those guys who want to study, but it's harder for you, for those guys who want just a certificate. Okay, anyway, that's all for today. Next week, we have 2 more topics to cover. The hepatitis virus on Monday, and on Thursday, we'll talk about HIV virus. All right? Okay. All right. See you.